On today's Two on Your Side town hall, analyzing the decision about the Johnson & Johnson vaccine and what it means for you and Western New York's efforts to get more shots into arms.
Plus, COVID and kids. More children are catching the coronavirus, and a local pediatric specialist has some important information for parents as we're seeing more kids heading back to school and getting more active.
And what does the Derek Chauvin conviction really mean? Two on Your Side's Ashley Holder talked with Canisius College's men's basketball coach, Reggie Witherspoon. Their conversation a little later in the show.
We are glad you're with us on this Friday. And topping our rundown today, Johnson & Johnson vaccines could soon start getting back into circulation. This advisory panel for the CDC said just moments ago that the U.S. should continue administering the shots after that pause earlier this month.
Now, this is not a final decision, but it is an important step. And the CDC's advisory panel voted 10-4 to recommend lifting the pause. But there is a catch here. The group says there should be a warning about the increased risk of that very rare but severe blood clot. It's now been documented in almost a dozen women. Most of the experts in the group said the benefits outweigh the risks. Joining us live right now is Dr. John Sellick, hospital epidemiologist with Kaleida Health and an infectious disease expert and a friend of the town hall as well. Dr. Sellick, thanks for coming back.
Great. Thank you for having me again.
So, Dr. Sellick, this recommendation now goes to the director of the CDC. Dr. Rochelle Walensky said just earlier today that she will make a final decision very soon. She obviously knows how important this is, and she will factor in the panel's recommendation. Let's just start here with your impression on what happened today and what is the real takeaway for our viewers.
Well, it's very interesting. I've been sitting at the computer here since about 2 o'clock watching all of the proceedings with the Advisory Committee on Immunization Practices, and it was really an incredibly thorough discussion, very insightful questions, and a lot of data presented. And I think that one of the important things to come out of this, that everyone should realize that this was not a bunch of people sitting in the cafeteria saying, yeah, let's move forward with this, that this was a very, very thoughtful process. So they recognize that even though these clots are rare, they are serious, but looking at the overall risk-benefit ratio, that even factoring in this infrequent number of clots, that the benefits of this vaccine on deaths, hospitalizations, and winding up in the ICU wound up being favorable in almost every scenario, looking at different segments of the population. So the general feeling was that we really need to do this. One of the important things is the ability of using the J&J as a one-shot vaccine. So especially in terms of vaccine equity, people who have difficulty getting to get a shot, let alone getting a second shot, people who are homeless, homebound, seasonal workers, people who are incarcerated. So there are many things that went into this, and on the whole, the balance was that the benefits far outweighed the risk.
And it has been a couple of weeks now since the blood clot concerns were first raised, followed by that pause. How soon until you think we may start to see J&J vaccines administered here locally? And what is your message to people, particularly women, who just don't want to risk it and would rather get one of the other shots?
Yes, and I think that was another big part of the discussion today, and actually the vote, as you pointed out, was 10-4 with one abstention. That the feeling was that we have other vaccines and that people should be able to make that decision. I would encourage people to think about what they are doing with this, discuss it with their physicians, and then make the best possible decision. And by the way, the very detailed data analysis that the CDC staff did showed that there is really no risk of this clotting phenomenon with either the BioNTech, Pfizer, or the Moderna vaccine. So it may well be that younger women may decide, I don't want to take this risk, even though that vaccine is immediately available, and opt for one of the mRNA vaccines.
Really great to get your insight on all that, and thank you for paying such close attention to that kind of meeting that was happening and walking us through this. I want to talk right now kind of bigger picture looking at the pandemic. For the third time in a week, Governor Andrew Cuomo took a question from one of our reporters today. Kelly Dudzik asked him about the higher than average infection rate that we're seeing, here in Erie County, and also concerns about vaccine hesitancy, because it doesn't seem right now like there is as much demand at our vaccine sites as we saw a couple of weeks ago. Listen to what the governor had to say today when asked about that. Okay, yeah, that's not what the governor said. He basically kind of combined the fact that he thinks people maybe aren't wearing masks as much as they should be here locally, and that there may be a connection between someone not wanting to wear a mask with someone not wanting to get a vaccine. Do you in any way connect those two things?
I think that in some cases there's probably a connection there. I look at what's happened with us recently with this, this third wave, if you want to call it that, as being a kind of an unholy alliance of two things. And the first one is these more widely or more easily transmissible variants like the B117, the UK strain, and the B1427 or 429, which are the strains that came from Southern California. So we're reasonably sure that those are around, and we're starting to get more data from the sequencing that you guys have shown is being done locally. And I think you mix that with people being a little too anxious to get back to what we want to consider to be a normal life, not wearing masks, not paying close attention to avoiding crowds and such. So you put those two things together, and it's bad. And that's exactly what happened in Great Britain when that variant was first identified. And the same thing happened in Southern California when those two variants were first identified. So I think those two things come together. And certainly the people who don't want to get the vaccine and don't want to wear a mask and, please don't tell me what to do with my life. There's certainly a segment of them as well.
We have the governor, saying that he believes mask compliance in Western New York is lower than other parts of the state, and that's why the infection rate here is the highest in the state. But meanwhile, there are some scientific studies out questioning whether outdoor mask mandates are making a difference. So what do people at home really need to know about still wearing masks when it's necessary, when it's not, and ultimately why all of this matters? It seems like something that we talk about a lot, but it might be something here in Western New York that we need to reiterate.
Yes, I think that everybody has to understand we have to keep wearing masks until we really get this beaten down to, an absolute kind of minimal number of infections. Wearing masks outside is it's a little bit nuanced. If you're out running or, assuming the golf courses dry out one of these days and I get back to playing golf, I'm not going to wear a mask in that setting. But if you're at an outside party and there are a lot of people close together, just because you're outside doesn't absolve all the sins. You really need to keep wearing a mask in that setting. And the other important thing, if I get you to wear a mask, I also need to get you to get immunized. The vaccines are our ticket out of this. This is really, again, we have very, very safe vaccines. The vaccines work against these more commonly spread variants. So it just increases the importance of doing these things now so that we don't continue to keep going along with this volume of cases that we're seeing.
Yeah, you're right. Nuance is important and doesn't fit very well in a tweet. Finally, Dr. Sellick, I want to ask you about the current infection rate here in Western New York. Again, we've mentioned it's highest in the state. Erie County is our most populous county in the region. It has the highest rate of tests coming back positive in Western New York. But at the same time, late today, the county announced that 56% of the eligible population here in Erie County has gotten at least one dose of vaccine. So kind of the mixed news there. We're almost out of time, so as quickly as you can, how do you think we're doing generally at this point?
I think we're doing well vaccine-wise. It's certainly worrisome when we hear that there are, more slots opening up that might suggest that people aren't getting it. But we have seen a little bit of a change in that upward bound curve has started to flatten out a little bit and actually starting to show some sign that maybe we're we're making a little bit of a hairpin turn there. So hopefully that's going to be the case. These are not the places where you don't want to be number one or number two. It's Erie County and Richmond County, which is Staten Island, flipping back and forth between 1 and 2, and we don't want to be up there.
Always appreciate your expertise. Dr. John Sellick, thanks again for being here. Have a great weekend.
You too. Be safe.